All right.
Okay, thank you.
All right. So just a reminder, we had started this a while ago with the physical therapy case files. And while we have kind of changed our, the way we're running things, because we very much wanted this to be interdisciplinary. We did not want this to just be PT related. And so we had started with case studies that were provided for us in this book. And when I met Susan at the part 2 course in November in North Carolina, and she told us about the very rural area that she is living in Mexico, and the challenges that she is having, just because of the limitations in medical care and in other basic necessities in her area. I said, oh, your patients, and she was just seeking just anything she could get. She's like so open and receptive to. So I said, okay, this case studies group that we've got could be a very wonderful avenue to present her patients and to discuss what she can be doing with a variety of tools, with a variety of strategies, obviously incorporating hippotherapy, but, obviously, we have a wealth of knowledge amongst this group here. And I know Susan is, more than open to hearing, everybody's suggestions on her patients. So, she's been so good. She sent me all the videos. I have divided them into files. I've got, she sent me information on each child. So we're gonna go ahead first of all and introduce Susan, have her introduce herself, tell you a bit about what she's doing, and then we will start with a patient, and if Adria is able to show the video, then we will do that. But at least we can discuss these a few of these kids today, and plan another way to show the videos another time. So Susan, why don't you go ahead and unmic and or mic and tell us about yourself and about your what you're working on in general, the facility that you have and the program that you are operating.
Okay, well, first of all, thank you. Thank you so much for reaching out and for trying to help us down here in Mexico. I'm a PT. I've been a PT since 1983, graduated in the University of Delaware. I'm from New Jersey originally. I spent over 20 years in San Diego raising my kids, being a PT, outpatient ortho. And about 23 years ago, I started going south of the border and started to do some physical therapy on weekends, which turned into every other week, which turned into full time about 13 years ago, where I started 3 special needs orphanages. But the big need is in the rural areas where the families are and where the orphanages are not. And there's just so much need. It's only 2.5 hours south of San Diego. But you would think sometimes I'm in the middle of Sudan sometimes. And the hardest part for me is not having any support from other PTs or speech therapists or OTs. There is no OTs in our area at all. There's a few speech therapists, but they don't know much. And they're very expensive and inaccessible to the kids. So basically what I have to do is wear a lot of hats. I do PT. I worked on I do speech, OT. We do wheelchairs, walkers. We adopt the family. So the family is extremely poor. So it means taking them to specialists, paying for the consultations, paying for MRIs, paying for diagnostics, all kinds of things. So we incorporated horse therapy, hippotherapy, probably about 4 years ago. We started, and we have 2 horses that we use. We acquired land. Now we have 3.5 acres. So we're building a house, but we also have these little houses, these little casitas on the property. we now have a Mexican trained young girl who's she graduated as a special needs teacher. So at least I have her. Loma Linda University has been coming down for about the last year, every 3 to 4 months or so, and bringing speech therapists and speech therapy students. So we've learned a lot from them, and I try and send some video to her because a lot of our kids are nonverbal. We have about 5 kids now on the autistic spectrum under the age of 5. And we keep building. Right now we have 40 kids on the roster. We see about 7 kids a day out there, but it's very small. It's just me, my husband, and a handful of like 2 or 3 volunteers and a couple of horses. So we just, I just wanted to learn as much as I could to maximize the potential of the kids that are in our areas that are extremely needy. They're extremely low functioning, a lot of them. And quite honestly, there's not a lot of help. And even if there is help, it's inaccessible financially or logistically. They come, usually I have to go drive them. So I'm also driving them back and forth. They're coming in strollers and over bumpy roads in order to get to us. So I just want to thank you a lot, because we're just trying to learn as much as we can, help the kids as much as we can, and get some input from you guys, because that's the biggest thing I miss is an interdisciplinary team, or anybody that's a trained therapist with ideas on how to help us.
I am just introducing Susan to the concept of our Facebook page. So we'll get her on that, and hopefully we can share, you all can share information with her. Susan, why don't you go ahead and put in the chat your email address and any contact information that anybody could use to communicate with you, so that after tonight, if any of you all are interested in individually being involved with what Susan's doing at any level, feel free to contact her. While you're doing that, I am going to try. I just want to try one other thing here and see if I have any luck with
Oh, Susan, Laura just asked in the chat, how do you fund your program? Oh, you're muted.
Okay, so it's day to day. We don't know what month, how much we're going to have day to day, but we are considered missionaries down here in Mexico. So we do have a 501c3 covering in the States, and I can write that down. It's commissioned to every nation. So if somebody wants to help donate, they just go to our page on that website and donate, and then they get the tax credit from there. Like my parents, we have like probably 10 people that routinely give monthly, and so we just really depend on checks and on people's generosity and that they share a vision with us, and whatever we get is pretty much what we can give. So it really varies. And for me, that's hard also, because I have to prioritize and triage different kids, like, for what's most important.
Oh. No! Did she hear you?
No, I don't think so.
Okay, so I'm going to go ahead and start just by seeing if I can share something on my screen. And again, if I can't, then can you all see anything on my screen right now?
Yes, I can
Yeah.
see Nicole's
Yep.
write-up.
Yes.
Great. Okay. So Susan, let's go ahead and start with Nicole. And since you can see the screen, why don't you go ahead and read this and then add anything else that you want to add about her, to at least if we are able to show video, great. If we're not tonight, at least people will have a bit of a picture in their head about these kids, and then we will come back together next time with a video that works. So
Okay.
do you want to go ahead and present Nicole?
Okay, yeah, Nicole right now is she's a 3-year-old with a little girl with cerebral palsy. She has significant spasticity. She has hip and knee flexion contractures and is developing more of a significant thoracic kyphosic because she's kind of in a C position most of the time where she sits. She can crawl symmetrically, and she can now learn to pull to stand. She does attempt to cruise. What actually stops her from cruising is she does have a lot of adductor spasticity. So, and she does have some knee flexion and hip flexion contractures, but she tries to cruise along. She tries to get up and down off her couch now. She can do that. She has difficulty advancing a walker. She really crosses. She's because of the adductor spasticity, it's very difficult, and the knee flexion contractures, it's hard for her to. I do have her sometimes in a gait trainer, but again, it's difficult for her. Her medical treatment, she does have actually a little bit more active parents. They have a little bit better job, so they do have a medical system that is paying for Botox, which is extremely rare. Most of our kids do not get that, but she does. So they've only done Botox on her hamstrings every 6 months or so, but they never did anything with her hips. She has bilateral hip dysplasia. They don't do anything for that here. Let's see, she loves the horse. She's not verbal, but she likes to communicate. She babbles a bit. She'll say like, uh-oh, and she might say papa, a couple words, that's it, but no functional communication. And so we've done a lot with the different positions on the horse, and she does love it so much. And I put her, let's see, I said incorporated like stop goes, for her trunk control and for her head control. We put her forward, backwards. We use like hula hoops and things to get her to reach, and she has some ability to reach. One hand is better than the other as far as her grasp is. We encourage her to cross midline with her activities. She could clap now. She's imitating a little bit more. But she is minimally verbal. She is unable to like blow bubbles. She's kind of a little, I don't want to say ornery, but a little bit. She only likes what she likes, and she will do what she wants to do. But that's, she's pretty stubborn in some of those ways. So that's what we do on the horse. But I do traditional physical therapy also. I do have a standing frame that I use for her. She's able to tolerate that a bit. But, it's really hard to get kids in standing frames at home because I don't have them for the home, and it's hard to do. So they only come once a week. So it's not like the standing frame, can be used a lot. We're working on trying to make standing frames out of wood. And my husband is quite handy. So we're working on getting kids their own standing frames so they can stand better, in longer times at home.
Awesome. So just questions that you all might have just to, just with regards to that particular scenario, if you were considering this as a paper patient at the moment until we get to see her. So Susan, how's her upper extremity function?
Well, like I said, one arm, she can use both hands. One is much more spastic than the other. So she chooses to use her right hand a little bit more than her left hand. She will grasp things. She will be able to squeeze things. But I mean, she can't, her fine motor isn't great. Like she has grasp, but not really enough to like write anything or hold a utensil necessarily. But she can grasp at a toy. She can hold a toy.
So when you're talking about the walker, what type of walker are you attempting to use with her? And
A gait trainer. It's a gait trainer
a
with
gait trainer.
seat.
Okay, so she's
Yeah,
not
with a
having to
seat.
weight bear on her upper extremities. She's
No,
okay. All right.
no,
And then my other question to you is when she has the Botox in her hamstrings and how much range, how close to fully extended are her knees when she's got the Botox?
she's probably minus 20 to 15.
With the Botox.
Yeah,
So without the Botox, when she's
probably
gone,
more like 40, but
okay.
she can't get full. And here what they've done is they give her these we call them fidulas, like there's a knee immobilizer kind of thing.
Yes.
So another person has given her like knee immobilizers, so she can use those. Actually, I think I might have given them to her at home to try and keep her a little bit more straight, since she doesn't have she doesn't have a stander or anything at home.
Okay. So I know all you guys are sitting out there. We're seeing your names on the screen. Susan would probably love to see your faces. We're really looking for interactive participation here. So, especially if we're, not successful with showing videos tonight, we're going to be looking for other people to be, throwing in some ideas. But I would love to, just love to see everybody. So does anybody else have any other questions about this little girl? Okay, so just so I'm understanding, Susan, each of the kids that you have sent us the information on, all these kids that you're seeing them once a week.
Yes.
And you see them for how long?
Okay, usually it's once a week, and it's for an hour. It's usually because we do have the special needs teacher. So depending on the kid, what order it goes in. Like if they're autistic, they might start out with the horse, depending on their sensory issues. But they pretty much spend at least 20 to 20 minutes, with the special needs teacher, 20 minutes or 30 minutes, like in the traditional type therapy room that I have. And then 20 to 25 minutes, whatever we can get them on the horse, depending on, of course, the individual child. Because I don't have OT, because I don't have speech, we have these little houses. So they go from one house to the other. So I have a PT room, but then I also have a speech and language room that I go into. And that's got more like the kitchen and more of the OT kind of things and the manipulatives and the, the things that we do with our hands and things that stimulate speech, which the therapist from Loma Linda helped me, they gave me a lot of cues on how to incorporate speech, how to encourage speech and joint attention and those kind of things. So.
Okay.
But some of the kids come twice a week, but if they do, it's Saturday is their second day, and it's mostly the horse, and they interact with each other, and the parents are there. There's more kids. On Saturdays, we have like anywhere from 7 to 9 kids. Pretty much they all come on almost at the same time, and we have this big old play time in the middle, and we pull kids out. But this is a way for the parents to talk to each other. The moms can get a chance to talk to each other and support each other and compare notes, how parents do.
Right. Okay. No, that's fantastic. So these parents, when you're treating these children, be it the special educator or you, and you, it sounds like, are wearing many hats. You're being the PT, the OT, I'm the speech therapist, and you are using a PT gym area and then another area that's more for the OT/speech aspect. And then you are out there with them with the horses as well.
Yes.
Okay. Are the parents with you, or whoever comes with them, are they with you as well during this time?
Depending. Sometimes they just like to have their time, and sometimes the kids need their mom there because they're so little. So it depends on some of our parents are very involved and some of our parents kind of aren't. So it depends. We try, but there's always somebody there. Sometimes the kids are better without their parent because they're a little whiny if they don't have their parent there. So then we say, no, you stay here. But if the kid kind of is better with their parent, then we do. But we try to incorporate these kids eventually into like a regular school setting, especially if they're on the spectrum. So we try not to let them go into the school classroom without the parent, just so that we can get some separation from the parent so that the kids get to be able to be without them a little bit with, more independent without the mom always being there.
Okay. Is there I totally get it. I think every one of us can relate to we have some whose parents are really involved and some whose parents are not at all.
Right.
We've all experienced that, but in the effort to get the involvement, and I totally get how you want to separate the kids and give them the opportunity without the parents, but do the parents have a way of observing what's happening with these little houses? The way you have it set up, can the parents observe without the kids being even aware that the parents are observing?
Yes, we have windows that they can see. And usually what we do, if for some reason we don't have the parent in the room with them, after they're done, the mom comes in and we explain what we've done, and we will explain how they behave with certain things, and we encourage them to follow up and do the same things that we're doing with them at home, because we don't see them that often. I keep telling them, like, we're only here for an hour once a week, but you have them 24/7. So for us to gain anywhere, you have to do some of this on your own at home, and some will do it and some we know don't. So
right. What about cell phones? Do these families have access to cell phones?
Some of them have access to cell phones, some of them only have cell phones that are not smartphones, so they're just for calling. We still have those. The problem with them is that you're really poor, and so they can put money on their phone. But when they don't have money, they don't have plans like we do. So they have, so sometimes they have money to put on the phone and sometimes they don't. And when they don't put money on a phone for a certain amount of time, they lose that phone number. And so they have to get another phone number. And so I probably have sometimes I have 6 or 7 phone numbers for somebody and I have to delete them all. It's like, which one is the one you have now? So.
Okay.
Mm-hmm.
I guess the reason I asked that was thinking about how things are nowadays, that we might say to a parent, why don't you video what we're doing here so that you can remember what it was we worked on, as compared to the olden days of drawing. I used to draw stick figures and literally write out, the little home program exercises, and then we kind of had the in-between with the software that actually, generated a little exercise and a picture. Like, how are you educating your families as to, how do they know how to follow up?
It does vary. Again, like we have parents that have decent jobs and have that ability to do that and have the ability to take pictures and things and video. A lot of our kids, they don't have that ability to do. And honestly, some of our parents don't read or write. They've never gone to school. So they don't read or write. I can't even text them. I have to do a voice message to them. So they're different. It's just over and over again, telling them things and then bringing them in at the end and actually watching them do it physically, So it's all through the spectrum of, I have one person with the Rett syndrome. The mom is a university professor. And then we have ones that have never gone to school in their entire life. So it's a huge, and some of them don't even speak Spanish as their first language. We have indigenous here. So their first language is an indigenous language, which they speak to their children at home. And so sometimes I'm not sure if they're babbling or if they're actually saying indigenous words.
Wow. Wow.
Which is
Interesting.
also challenging.
Yeah, definitely.
Yeah, I'm thinking she's babbling and she's actually saying something in Mixteco.
Yeah.
But that usually I have a sibling that will tell me, no, that's Mixteco for horse or something. But I need help with that. So
Wow. You
Yep.
definitely have your hands full for sure.
It's a challenge, but yeah, it's fun.
All right, I am going to see if I can screen share a video, and if I can't, then Adria is going to try, because I did something different here, and we'll see if it makes any difference at all.
There's something.
Okay. Hopefully this is Nicole.
It's hard to tell. I don't even think that. Yeah, that looks like her. Yeah, that's Nicole.
Okay.
She's
So I'm
got
going to
glasses, I can't tell.
I'm going to slow her down. Actually, I'm going to slow her way down. And I've got her on a loop. So at this point of the game, I don't have the chat up. So please, everybody, feel free to make comments or ask questions. One of the things that I've already talked with Susan about, and in this particular situation, the leader's looking pretty good as far as position with relationship to the horse compared to some of the videos that you will see. So that's already been addressed, and Susan and I are going to be working on that to enhance the horse handling. But so this is Nicole, and this is the little girl that you're telling us has some pretty tight hip adductors, correct?
Yes.
Okay. All right. So does anybody have any comments or questions? Let me see if I can pull the chat box up as well without losing everything. Yeah. Okay. Anybody have any comments? Okay. How does she tolerate the stretch of the backwards facing? So being in the rear facing position, Susan, obviously the lower extremities, Nicole's lower extremities are at the barrel of the horse. And so that's the widest part of the horse. How is she doing with tolerating that adductor stretch?
She's fine with that. She doesn't complain about it. No, it's mostly like I can stretch her, but she goes right back into it. She likes to obviously W sit, that kind of thing, and it's more active. The more active she is, the more she tries to walk, the more she scissors.
Sure. The greater the effort, the greater the tone.
Yes.
Okay.
Yes.
Are you able to do anything to work on strengthening hip abductors at all? Can she get any semblance of a clam? Do you know what I mean by like a clamshell exercise?
Clam. Can she
So
do it?
that's when they're laying
Can
on
she
their
do it
side.
actively? Can she do it actively, you're saying?
Yeah, or if you were to help her, can she get an isometric,
She can. You
isotonic?
know what she's doing? Yeah, she can a little bit. She can't really do it actively. I can do it passively. She does crawl symmetrically, and she's starting now to high kneel. She does a lot of high kneel, but and I separate her, trying to get her into more ABD duction while she's high kneeling, while she's doing stuff in the PT gym.
Okay, so we're getting some comments here. So how is she different when sitting forward versus backward? Hopefully we're going to be able to show you a video of her facing forward. But Susan, what do you see different? So you can see the active reaching that she's doing here with her hand.
Yeah, she loves to touch the horse. She loves to go touch on him. That's what she's trying to do right now. And she does it more to the back for some reason, and these are very new sidewalkers. And so I'm trying to take the video. My husband's actually leading. And, so normally I try and get them to, hold her up and get her weight bearing on her elbows and her shoulders to get more head stability and stuff. But she was definitely leaning forward. They're desperately trying to touch Chonita's back over there.
Okay. And yeah, for those of you who are familiar with the term entrainment, I am impressed, looking at the horse leader and the horse, that there's some entrainment during a portion of this that you will see. But you can tell this is a new team because the entrainment is sporadic. So there's another comment here. It looks as though there is too much impulsion based on head movement, ? Hard to tell for sure with changes of the angle in the video. So I think that perhaps what's being commented on here, Leslie, is like her hypermobility that we are seeing in the cervical spine. I have to wonder personally if this is because we're not getting a lot of motion actually happening in the pelvis. And so I think, it's got to go somewhere. And I think that might be why we're seeing more in the cervical spine. When sitting backward, does she have knees bent? That's another thing too. Does she have knees bent, or are they more straight around the barrel? Just wondering if she's getting into a W sit position with some anterior tilt at the pelvis in rear facing or not. Hard to tell with the sidewalkers there. And yes, that's absolutely true. It is hard.
It's hard to tell. Yeah. Yeah. Cause I'm trying to videotape, trying to tell them what to do and trying to see what's going on. Yeah. She usually, when she's facing backwards, I'm trying to tell the boys to try and get her hips down, and they should be. It's hard to tell with the pillow where their hands are, but like I said, I think the one boy on the right is like, it's his first week, actually. That's how early he is. But especially when she was sitting forward, I tend to say, okay, make sure she's coming down, make sure she's getting, pushing her hips more, not letting them go into flexion or a deduction. And normally I have her elbows up more on the pillow, giving her more
so more of like a prop on, like a forearm prop.
Yes, and that stops the head bobbing. But she sees a lot. She's in a C sitting position a lot, and that's what's so hard. And that was one of the questions I had at the course, because a lot of my kids are so posterior tilted. My big question was, how do I get that anterior to, how do I get that pelvis up? And everybody said, oh, well, put her this way. So I do, but I still see the posterior tilt in her. It's really hard for me to get these spastic CP kids to get into a better lordotic curve, and they're staying in the posterior tilt.
Yeah, the key is really getting the hips open, the hip angle open. You've got to get the hip out of the 90 degrees.
Yeah,
You
pulling
typically
them
see them
down,
sitting
pulling the hip down.
in order to open up that hip angle and get the pelvis in a more anterior position. Another comment here, try a wedge or towel under her bum when forward facing. Yes, absolutely.
Okay.
And I've had
Yeah.
good luck with propping under the glute with wedge. Okay, so the same thing. So let me stop sharing this and see if I can get another video up this way. So just bear with me here. This has been truly a learning curve for me here, but it's there we go. All right, let's see here. What else is up? So that I'm going to X out of, and I'm going to bring another one up. All right, here she is facing forward. Let's see if we have success with this. All right. Can you all see this video?
Yeah, I can.
Yep.
Okay.
Yep.
So again, we're not going to address the horse leading because that's going to be addressed with Susan. And again, I'm going to go ahead and put this in slow-mo so we can see her. Forward sitting. And again, it is hard just, to see with the sidewalkers. But Susan, I do want to commend your sidewalkers. You could tell that the young man on the right is new. I think all of us have been there. We all see this, that new sidewalkers look down 90% of the time. This is new to them. They're trying to figure out where they're going, and they're trying to figure out where they are in relationship to the horse's feet. And so they're looking down, which this young man certainly is. But I give him credit because he is looking up from time to time. Your young man here on the left is very attentive and very engaged. And so, nice to see and to know that even he's not been with you terribly long, but he definitely seems to be more in rhythm with the horse here and working well with Nicole.
Yeah, that's
Right.
great because the boy on the right is 17 years old, and the guy on the left is like 26, but his mom is a director of a special needs orphanage, so he's more comfortable with special needs kids. He's been around them his entire life, so that's very good very observing on your part. Yeah.
Okay, so we got some more comments here.
There's a C with
Can
it.
she passively achieve the neutral pelvis?
Passively, yes, but she doesn't do it actively at all.
Yeah. Okay. Well, that's all going to be dependent upon her
Because
hip
she's
position
only,
for
she's
sure.
only 2 years old, and that's my big concern is I don't want her to lose that.
Right.
Yeah.
Also facilitate along the paraspinals for cueing upright posture through the session. Love that increased engagement, awareness, and improved affect when forward facing. So yes, she is seemingly more engaged in this particular position.
Definitely.
So what I would comment on, and please everybody continue this is fabulous, is to look at her hip angle right now. And you can see that she's pretty much in a chair sitting position. She looks pretty like 90-90.
Mhm.
So I would be very gently working on trying to, yes. So again,
Bring her
being
hip
commented,
down.
she's in a lot of hip and knee flexion. So I'd be
Yep.
working on trying to bring that femur down, and you've got to be careful, obviously, that it's happening on both sides, and it's going to be very gentle with no forcing to try to open up that hip angle. Because again, you know, that 90 degrees just puts us in a pelvic
Yep.
tilt. But if we can open that up and get it more towards that 120, and I don't know what her, you know, you're telling me she's got pretty substantial knee flexion contractures. And so that makes it even harder to test her hip flexors. But do you know like how tight her hip flexors are?
I mean, they're tight, but I'm sure I could get her. She's probably, when I try and get her fully extended at the hip, she's probably only minus 30 hip, you know, hip extension. Minus 30 about bilaterally. And they're gonna start, they've never done Botox on her hips, but I'm working with now, I took her to a special neurologist who's willing to try and maybe release her hip flexors a little bit. So hopefully that'll help. But we'll see.
Okay.
Nothing happens fast, you know.
Yeah. So how about the adductors?
Yeah. Yeah, that would be also very helpful.
Are you wanting them
they have
released,
not.
or
They-
are you wanting them
no.
Botoxed?
Botox. We're gonna try.
Yeah.
You know, I've had mixed. What do you want to say? Sometimes when they release the adductors or anything for that matter, sometimes they release them too much, and then it's worse than it was before. So, we're dealing with, you know, maybe it happens in the States too, but it definitely happens here. So because of her better insurance, Botox is an option for her. So, and I'm working closely with her neurologist to be able to do some adduction. They have not done any Botox in her adductors so far, but they're open to do it now.
Okay.
I just wanted to have a little comment about Botox.
Yeah, absolutely.
So I'm kind of lucky in that I have an 8-year-old with CP. And
Okay,
so all
nice.
of this is very, very similar to him in some ways. He has some differences. His hip extension is great. But Botox is weight-based here. So in a child this young, it's really difficult. You have to do a lot of, you know, this time we're going to do these muscle groups, and this time we're going to do these muscle groups, because they just don't weigh enough to get enough in all the places that they need it.
Okay.
So you do have to be very selective, and I'm assuming down there is even going to be even harder.
Yeah, it's very expensive and harder
which
to
group
do.
to attack first, right? I mean, which one
Yep.
will do her the most good immediately? So
Yeah.
kind of the hard part too is even here in the States, it's difficult with a child that age.
Yeah. So what would you suggest? What, I mean, when they're like this, I mean, it seems like her big limiting factor is more at her hips than her knees almost. So, in your experience, what's kind of better? What you mean, they would only do either adductors or flexors, but not both? So do you aim for the ones that are the tightest and most limiting?
I would say what affects her functionally. So for my son, he commando crawls. He does not crawl on all fours. He can't weight bear through his arms. So his most tight areas are actually his pecs, his biceps, and now his hamstring. Because now that he's 8 or 9, he's spending a lot of time in the chair.
Okay.
For her, it sounds like it's the opposite. So the reason he has
Yes.
such good hip flexion or hip extension is he spends a lot of his time prone. And he'll prop up on his elbows and play with toys, but he cannot get into a quadruped position. So for him, it's different. For her, if she's getting quadruped and can crawl, I would say that those hip flexors are really going to cause problems with her positioning in the future. A lot of sacral sitting is going to cause increased, that kyphosis, which is going to affect her lung function. I mean, it's going to cause all kinds of problems. So me personally, I feel like you can stretch some of the other areas a little easier, but I'd really probably just personally probably attack the hip flexors first. I feel like There's a lot of other options for the hamstrings, and the adductors that would probably be my second route of attack, but yeah.
Yeah,
It's
no,
hard because
that's helpful. No, that's helpful. Thank you. Because
Okay,
I
I'm
do
gonna-
have a really good relationship with the neuro. So he asked me. So that's a good thing.
I'm going to go ahead and address some of the other questions that have been posed in the chat, Susan.
Yep.
Is this the narrower of your two horses or the wider of your two horses?
She's the most narrow. She's the most narrow. The other one
Yeah.
is wider. The one that I think she's more narrow.
Yeah.
Yeah, but we don't have much choice. Yeah.
Yeah. So the comment was, if she had a narrower base, could she open her hip angles more? But I think it's a matter of first of all, starting with people that are on the sides of her who are at least even trying to address it. Because right now in this video, that was not something that was even being addressed.
Right.
If the sidewalkers could hold under the pillow, that may help to facilitate lumbar lordosis and thoracic extension. It could be easy to accidentally pull her back into more chair sit by holding the pillow. Yes, I
could see that.
totally agree with that. Yes. So if that hand could be underneath and literally on her lumbar spine, like just above that pelvis, and helping her to get that extension and working with the movement of the horse, so that every time the horse, translates the movement towards the anterior tilt, that's when you even exaggerate it by having your hand, moving along, being on either side of the paraspinals and just moving along, not forcing anything, just really gently applying that pressure, but going with the movement of the horse and using that movement to enhance that extension. And then as you're doing that, working on gradually opening up that hip angle and seeing if you can get that whole tilt of the pelvis, from being more posterior towards neutral.
Yeah, that's great advice. And I think because normally I'm one of the sidewalkers, 99.9% of the time I'm on one side and one of the guys are on the other. It's just because I was doing the video. So that's great advice for me. And also, question is, how much I guess it depends on your sidewalkers. Do you do that? Or is it mostly like, the therapists that do most of that? Or do you actually teach your volunteers to do what you just said?
So it's usually been me, it's as the therapist to do that. So the idea might be that you would work with them, see if you can achieve that. And then you might be able to step back if they could maintain the position once it was attained.
Perfect. That's good to know.
And if anybody else has any other suggestions, that would be good. But yeah, it's hard. And again, this young man on the left, look, he's obviously going to be the easier one to train first.
Yes.
And this other one just needs to figure out.
He's just timid.
His general role he's 17 years old.
He's 17 and he's timid. And these are frail kids. He's a little scared of them a little bit.
Give him kudos, big kudos for being doing that.
He's very open to learning though. Yeah.
Okay.
My other question is, as far as equipment goes, this is obviously a boppy pillow. I tried, she's too little for the other one, the hippo, because it was too high up, that hippo helper, whatever, was too big. This is a boppy pillow. We also got one of those harnesses. So I don't know if there's any other things that you guys use. I'm going to try, I don't know I don't have any wedges necessarily, but I have tried some of the blanket things. Somebody told me a yoga wedge or something. I don't know. I haven't got one of those, but
you could literally take a little hand towel and fold it, just to have a little bit
under the ischial tubes.
Putting that under the ischial tuberosities. Yeah.
Okay. Yeah. That's what I'm going to add too. And try to encourage them to get her hips down, but they're scared to stretch her. As
well they should be.
Yeah. Okay. Right.
We want them, that's
they're cautious.
you know, that's what you do. And then,
Yep.
and then you can show them after
Yeah.
you've done it. But yeah.
That's what I normally do is I tell
Okay.
them, okay, after she's been on a while, okay, trying to get her hip down a little bit more, a little bit more, a little bit more, but
Okay.
that's great advice.
It seems that the right side walker may be pulling down on the support pillow, causing her to tilt more to the right, just a little more training, or make sure he speaks up
Yep.
for himself if his left shoulder arm is getting tired. And thank you for bringing that up, Shannon, because that's, you know, that is huge, and, you know, something that is like near and dear to my heart. And when I'm teaching courses, I'm really focused on that. And this guy's looking pretty good here in that his elbow's a little lower than his shoulders, but we do have to think about, you know, keeping those arms up for a long period of time. And that idea of maybe switching sides, or, you know, just making sure that they take a break and get that elbow down, because, you know, this is literally like being an overhead athlete. And you're going to end up with tendinous issues. You're going to end up with, oh gosh, I'm blanking on, you know, what happens when the acromion rolls in and it's impingement.
Impingement, rotator cuff. Yeah.
Yes.
Yes. Well,
So, you know, we don't want to see that in anybody. And certainly not in these young guys here. So that was a good comment. Also looks like she may be leaning right and left side is shorter. So you may want to change your direction to clockwise to lengthen the left side. So, you know, what side is her more involved side? Does she tend to lean laterally to one side more than the other?
yes, she definitely does. Definitely does. Trying to think, for her, I have so many kids. Yeah, I think it's more her right side is tighter, I think.
Okay. Okay.
And we do switch her back and forth. Like that's the most recent thing that we've done since the course is doing both ways and
Good.
doing the spirals one way and spirals the other way. We've really added a lot of those movements since the course, for sure.
Okay, and so it was asked, have you done stretches while mounted? This may be another option for, okay, and you replied to that. All right.
Yeah, we do try to, after, like during or afterwards, depending on the tolerance of the kid. She actually loves being on the horse. She loves everything we do. So for her, she lets us do pretty much anything.
Okay. I'm going to see if I can get another one up.
Where's up there?
Carol, can I ask a question?
Of course.
Please.
Well, I just posted that one about prone across the barrel for back strengthening. So if she can tolerate that and, you know, the shape of the horse is okay, you can also do some hip flexor stretches that way. That might be something that's helpful. Another position that I have done with kids that can tolerate it, and it's hard to tell, but I do a lot of very low level kids as well, Susan. So my heart goes out to you, and I'm so proud of you, and I'm so thankful that you're doing this, and I still want to come work with you. It's not even funny. But and I graduated from Lowell University, and I'm from San Diego, so I'm like, that would just be a very efficient trip for me.
Then you're coming down. I'll come get
I am
you.
coming. I'll be there. I don't know when, but
I'll come get you.
But you know, to try to get some anterior tilt, if she has enough abduction, and you're gonna get it easier facing forward than backwards. But if you can draw her knees back a little bit and have her in an anterior tilt position, with those hip flexors will probably pull her into an anterior tilt position if you draw those knees back. It's just whether she can have the abduction on that horse. It's hard to see the contour, and how long her legs are, but then you can get some propping on forearms on that pillow, or on extended arms if she's strong enough. And it may be that you have to start with that at a standstill and just see if she can go there. or walk 10 steps and stop and rest, and see what the movement does, because that horse does have a long stride with a lot of movement for her. And you just need to be cautious that you're not going to pull something too tight, or that your hypermobility in the spine isn't compromised. But I do that a lot, kind of like rock them forward. And so, not saying for her, but just to, I'm having trouble drawing the picture. So basically your thighs are vertical and you can have knee flexion. Okay. So you're not over stretching hamstrings and adductors. They're in an anterior tilt, but then you're getting some spine extension because they're propping either on elbows, on her boppy type pillow, or on extended arms. And so by tilting that pelvis forward, that's why I asked if she had passive, if she could get there passively, or if she's pretty stuck around it. But if passively she can get to neutral, you may be able to just kind of rotate her forward a little bit and proper. And so the force of movement is kind of into an extension moment versus into a posterior flexion moment, and then she's always catching up. It's more like the old German style dressage where they really sat on their sacrum and scooped their butt forward, versus now where they're more upright and they actually land like at the trot in a little bit of an anterior tilt mode. I'm a rider too.
Is it like you're trying to almost get her on hands and knees, but not quite? You mean like that?
Well,
You mean
kind of, but she's not. But her knees, if she has the range, her knees are around the horse.
Yep. Yeah,
And
she
if
can
that horse
do
is
that.
narrow enough at the top, you might be able to do that if her thighs are short. And I'll try
She's
to,
pretty little.
so I'll see if I can't send you some pictures of one of my kids
That
doing.
would be helpful.
And then you get kind of like a little bit of mobilization of the spine into extension.
Yeah.
But you
Yeah.
have to make sure that her hips and her legs can accommodate that position, or you're gonna, particularly if she has bilateral hip dysplasia, you're gonna have some issues. But is the other thing that you can try is to bring the surface up to her ischial tuberosity. So put a wedge under her bottom or something like that, so you're not cramming her knees down and apart. So there's a little bit of a layer there between the movement, but depending on the movement and her range and how much she can actually even tolerate, you may be able to kind of work at a little bit on both ends and see. And she probably isn't going to be able to do it for very long, but it may be that you can start with a little bitty, 10 steps at a time, and then stop and have her reach. And then you're working muscles and extensors, and then another half of the lap, and then stop and reach, and she's working extensors, and so there's not as much horse movement because the horse moves so much. But that's just something that I thought of. I'm like, I tried to type it in chat about 5 times and I just erased it like that.
It's easier to say it. It's easier to say it.
Yeah, but she's a lot like a lot of my kids. So
Okay.
I'll see if I can't send you some.
Yeah, that'd be
something
great,
like
because
that.
I got a lot of kids like her. So yeah.
Oh, really? Yeah.
And worse and more involved. She's actually one of the higher levels. Some of them are pretty involved. Yeah.
Yeah. That's awesome.
No, that's great.
Kudos to you.
I'm gonna put your name down and I'm gonna
Yes, please do. Please do.
Email me.
Okay, I will. I have it written down. Absolutely.
Perfect. Thank you.
All right, guys, we are going to move on to another child. So thank you for hanging with me here on this. So let's see here.
Oh boy.
Okay. Can you see Emmanuel's?
Yes.
Okay. So Susan, if you want to go ahead and take Emmanuel now, and
Yep. He is, boy, I need a lot of help with him. Where do I start? Okay, he is 4 years old. He came to me with a diagnosis of spina bifida occulta. But, however, this does not explain his severe global hypotonicity, and we're doing further diagnostic testing. He can speak, he's cognitively there. He has significant delays in gross motor and fine motor. He has very poor head control, very poor trunk control, crazy flaccid. He can roll with some effort, but not all the way. He cannot sit independently. He sits, but he is floppy. His fine motor skills are very low because of the severe weakness that he has in his hands and his upper extremities. He tends to be in a C-type position, posture most of the time. He would require, in the States, he'd definitely be in custom seating, but right now we don't have that. He sits in, unfortunately, he's extremely poor. He sits in a stroller right now that I do put a little tiny wedge, and I try to get him sitting better, but it's really hard to get him into the right postural position. We're waiting for this, the seating specialist hopefully will come and make a seating for him from Canada, but we have no idea when that will be. He's very shy, lacks confidence, but he's getting more confident with us. Because of his overall weakness, he also lacks, this is a speech thing, he also lacks volume when he speaks. He's not really even strong enough to really blow bubbles, or anything like that. He's unable to button his shirt or zippers, anything like that, because of the weakness in his hands and his upper body. He can eat, but he chews and fatigues very easily. He has difficulty gaining weight and receives supplemental formulas from us. I do get donated, not Pediasure, but I have a couple of kids on G-tubes. We get it's kind of like Pediasure, but I get it from the States, and it's another whole big thing that I do. He is scheduled for actually a brain CT and a cystogram to check on his neurogenic bladder. He is part of the Shriners program here in Tijuana, but they're the ones that gave him that crazy diagnosis. It's really, I'm thinking this is not spina bifida occulta, but let's go back to the drawing board. He's getting his CT scan. I just paid $400 today to get a CT scan and a cystogram, and under anesthesia. He's getting that on Friday. This is a lot of where our money goes to, because he definitely needs the diagnostic testing. And he's getting a little bit better slowly but surely, but yeah, I have a lot of hypotonic kids, and he's probably one of the most hypotonic I have now.
So Susan, there's a question here about where is his spina bifida level? Did they find a true abnormality in the spine?
No,
and
they did not.
He doesn't have a hairy patch or anything, so he doesn't have a level of spina bifida, because he most likely doesn't have spina bifida.
Correct.
Okay.
He never had any surgery on his back. There's nothing there that indicates that he has a defect in the lumbar spine. It's in his brain. I think there was, I'm like, this is not okay. So I did take him to the neurologist, and he went to there was a spina bifida clinic that Shriners in Tijuana has. And they include the traumatologist, like an orthopedist. They have a neurologist, a pediatrician, and a urologist. The pediatric neurosurgeon said he needed surgery on his head. And I took him to the neurologist, and he goes, he absolutely does not. They were talking about his fontanelles fusing too early, and so if they don't do this thing, that he's gonna wind up losing all function that he has now. It's a big fat nightmare. And I'm like, don't you dare. He does not need anything like that. It's like, you have to be a crazy advocate, because this guy wants to go do some brain surgery that I don't think this kid needs. So we're getting the CT scan on Friday.
Yeah, don't think you're alone, though. Unfortunately, it happens here in the United States as well,
Yeah.
So you're definitely not alone in that.
Oh, yeah.
So comments here, just, globally, anybody with regards to really low tone? Do you have any suggestions for her with regards to positioning? So one of the things that I had thought of, Susan, when I saw, your information about him, is wondering about using an abdominal binder or a belly
You
band.
did say that, and I've never seen or heard of those, to tell you the
Okay,
truth.
I will send you information. That's something that Mary Massery was kind of introduced us to the concept. But if you think about somebody who's really low tone, especially with him, and the fact that he just stays so collapsed through his trunk, is he has no intra-abdominal pressure, like no intra pressure.
Nothing.
And so it kind of helps to provide, if you think about people who've got back pain and they use those black lumbar supports, have you seen those, the lumbar belts that people will wear if they've hurt their back?
Yeah.
It kind of is on the same concept.
Okay.
It's just, like a bit of an elastic band with Velcro. And, it can be a couple inches above and below the lower rib and the top of the pelvis, so that you've got some support of the rib cage anchored to the pelvis. And it just kind of helps to provide that little bit of support.
Is that like something you get commercially, or is there something that we could make here or make
You probably could make it. I know that people, oh gosh, Mary
like what
Massery
type of material, that we would use or something.
I'll have to get you Mary Massery's.
I popped out for a minute, but I came back in. You're talking about abdominal binders.
Yes.
I know some people on very tight budgets have used, the thigh wraps, then like the leg wraps, the neoprene type ones that they sell at like the dollar store, and things for adults for exercising, not for
like a neoprene.
People are using things like that because they're inexpensive at like dollar store, Five Below types like that. The ones that I believe, I'll have to see if I can find the information, because I have 3 or 4 that the company that Mary Massery, like that they gave us the information. I think they just sent them to me. I feel like I maybe paid shipping or something. Because to use them as like trial ones. This was pre-COVID. I was
because he's a pretty tiny little guy, obviously.
Yeah, and they had a bunch, like they sent me a couple different sizes so that I was able to like trial them.
Nice.
Yeah, but I know people have gotten like the wraps that they sell at like CVS, the dollar store, things like that.
What's kind of the protocol for that? Would that just be to wear that all the time, or just like when he's up or just?
Yeah, when he's up and working on, against gravity. Yes, that would be.
I was thinking for your other patient also, I've seen kids show significant improvement in head control when we put binders on them. I use it
abdominal binders in the same place.
Yeah, I use it with a lot of my patients. It also, I find, helps with that pelvic position.
That's a great thing.
Okay.
Yeah,
so
I
it's
put one on one kid, and all of a sudden she like sat upright for the first time that I'd ever seen. And I was like, I should have tried this before.
And so like, I know there's a lot of, because I'm an ortho person, but if you use those wraps and stuff, it doesn't, and it does help. And I totally am going to try it, but it's not the kind of thing like if you use it too much, it's going to make them more weak because they're not holding themselves up, or you just do it temporarily and hopefully eventually they get stronger and then you don't use it again, or is the idea to use it like forever? You know what I mean?
I've personally used one myself sometimes, especially like my back's hurting and things. The ones that are just straight elastics, they don't have stays in them. We're not talking, like old style corsets that hold you up. I can slump in bed.
No problem.
I can get my C-sit position, no problem. in this. Um, it's an elastic band. It's not holding you up. So
Okay.
it
It
gives,
gives them like some
fluid.
feedback, like, yeah.
yeah.
Gives a
my-
little bit more than feedback. Yeah, I mean, it is giving some compression, but you know,
and
like she's
compression,
saying,
yeah, compression helps. And when
Yeah.
things are in better alignment, you use them better. And
Yep.
therefore you use them better. And the
Yeah,
more you
and I
use
think it would help their speech too. I mean, like this little guy, they don't have a lot of volume
Mhm.
because they don't have, like you said, they don't have any pressure to push out the air in order to even speak loud enough to be heard even. Like he can't, like for instance, he can't blow bubbles, like, you know, bubbles. So, but maybe with that on, he could, and that would strengthen him, because a lot of my kids, unfortunately, especially around this time of year, they're all getting pneumonias because they can't cough very strongly. And that's bad down here because of so many medical reasons, you know. I have people that don't have electricity, so I have to go buy nebulizers that are battery operated because they have solar panels or they have no electricity at all. So that's a whole nother thing. But to get them to have good effective coughs, because I have a lot of kids that can't do that, and they wind up in the hospital with pneumonias. Yeah.
So that's supposedly, you know, theoretically, one of the things that these do is by providing that little bit of elastic resistance to the diaphragm, it helps to promote that activation of the diaphragm. And that's really what you're talking about,
For
is the
sure.
diaphragmatic activity.
For sure.
Yeah.
Oh, kinesio tape. I like that. Yeah, I know. I have some of that.
Okay. I know we've got a lot of new.
Yeah, this is my other
messages
horse, by the
here.
way. This is my old horse. This is Sherman. Yeah, he's the short old one.
6-inch ace wraps, Celia, that's a good idea too. Just don't
Yeah.
get too tight. So yeah. And I
That's
love
it.
the idea of the pantyhose tops. That's a great idea. So another
Economical
thought.
way. Yeah,
Yes,
me
yes.
too. Me
I don't
too.
know, too many people who wear a lot of pantyhose anymore, but I'm sure we could get people to.
We can try
make that.
that too. Yeah.
All right, let's see here. I try to use a horse that tolerates a very slow walk to decrease propulsion for a more controlled movement if you have the resources. Okay, that was the kinesio. Yes, and the compression, we talked about that, the ACE, bit of proprioception, the kinesio tape. Okay, all right, we've covered the bases there, so we're going to stop sharing this one and get a different video.
While you're pulling that one up, I just have a comment on that video. They were also pulling that boy backwards so he wasn't sitting up straight. He needed to be also facilitated more at the pelvis to come more forward, because he did have the lower extremity range to come forward. So I just noticed they were both really pulling him back. I mean, you could use some compression through the shoulders to give him some proprioception if he was upright, but I think they were using it and he was kind of pulled way backwards. So
They're pulling him back because they know he falls forward. If they didn't, and they're young and they don't know, but yeah, if you don't touch him, he's in a ball. His head is on that pillow. So they have to learn how to grade that better. And usually I'm there holding one side, but yeah, it's like they're the most scared of this kid because he's so frail. He's so floppy. They just don't know what to do with him.
that's the same, pulling him back like that too. He's not getting the full benefit of the horse motion because he's not upright.
Right.
And that when you lock the pelvis back, that horse motion doesn't really translate through his trunk as well.
Can I give him a wedge too? Also use a wedge for him too, because he's in a C, but he's in a C for a different reason. He's in a C because he has absolutely no muscle. He has no tone. He is one of the floppiest kids I've ever seen.
So one of the things that I would suggest, and again, that this would be a small investment, but if you're familiar with the physio rolls or the peanuts and getting like the smallest one they make and placing that behind him And then
Yeah.
it gives them something to put their elbows on, but it is pressing up against his pelvis and his low back. So it gives them a counter pressure. So that he's getting pressure to the pelvis and the lumbar spine to come forward while you're bringing the shoulders back.
So
Does that
it's
make
a
sense?
peanut one, but I have a peanut one, but it's huge. You mean a small
Yeah,
one? I don't,
tiny.
a tiny one. Really?
Mhm.
And yeah, can I just, I don't know. I mean,
Is
I'm
the
willing to
red the
buy anything.
smallest? Is the red one the smallest one? Is there one
No,
smaller than that?
yellow or blue, I want to say, are the little tiny ones. I think I used to have a blue one that was
Yeah,
really
you can
small.
tell me where to get one of those. I'll definitely order one because I just don't have a whole lot in our, I don't mind buying stuff as long as I know I can use it and have a place to find it.
Oh yeah, this particular piece would be useful for a lot of kiddos. Let
Yeah.
me
Yeah, if you can send me the info on that, I can see if I can get something like that. Because yeah, we don't have anything like that.
I'm gonna say I have a kiddo that so he has CP, but so his trunk is very hypotonic, but his limbs are hypertonic. So it won't be the comparative, but we also use the hippo helper on the lowest setting. And what we do is we forearm prop, and I have my other sidewalker holding his arm here to kind of bring him forward. So that way, when he is working on lifting his head, he's getting kind of more that trunk extension and head extension. And that kind of really helps him because he's the same way. He's very floppy in the trunk and the head. And he actually wears a Helsinger collar most of the time. Yeah. And when we are mounted, we use it 50-50. So there's times I'll use it because we're working on trunk control or other things. And then when we slow down and really want to work on neck control and kind of tucking that chin in, I really bring him forwards. That way, when he's bringing his head up, he's kind of extending his spine, and then he's getting weight through his shoulders and elbows to really help with that proprioception since he's so floppy.
Yeah.
I don't know if you have any type of Helsinger collar that might help him too.
I don't know what that is, but I do know the little pillows that we use for him are the ones that we get in the airplane. Like we have a few of those, but and sometimes I'll use that too. Sometimes I don't use this hippo helper. Sometimes I use that boppy pillow because he's still really little. So this, I wasn't sure. It's either this or the other one, but something to put there. But he will collapse at the shoulders unless you hold him there too.
So the smallest one is the blue one, just to let you know, and it's 12 inches when it's fully inflated by 20 inches. So you wouldn't even have to fully inflate it. So didn't mean to interrupt there.
Okay, no, that's good to know. I just need to know where to get one, and I do need more things to prop kids. So,
and I put the link for like one of the Helsinger collars. It's just Amazon because I figure that's universal, but I'm sure there's other websites you may be able to find that are cheaper or.
Yeah, I can get stuff on Amazon, and then I go to San Diego at my mailbox in San Diego and pick it up. So I can do that.
Why don't you give us your address, your San Diego address as well?
Yep. Yeah, I go there like once a month to pick up basically Amazon stuff when you guys tell me what I need, and I try. Sometimes it depends on the cost, but sometimes I can, because it's important, I mean, we want to make sure we maximize these kids' potential. That's the main thing we're here for.
I did have a quick question. So with my kiddo, he outgrows braces and immobilizers and all that, all of those fun things. Is that something you could utilize down there or?
100%. 100%. All the wheelchairs, walkers, braces that I give these kids, they're all donated. And I go to the States and I pick them up. And then I bring them across the border in various ways. But I do have connections to cross the border with some things now. After 23 years, thank goodness God has blessed me with some good people at the border to help me cross some of these things. Because we have a nonprofit in Mexico So they know what we do by now. That'd be great.
For the OTs here, I thought I would show the hand function video that you had shared.
Yeah.
So let me do that. Can you tell us how he's sitting while he's doing this, Susan?
Well, yeah, he is with the special needs teacher. He is sitting on there's just a regular table, like a little kid's play table. He's sitting on a regular little kid's chair, and because he's so dang short, the teacher has him up on it's a cushion. That's a vibrating cushion that we use for our kids with autism, because they have that vibrating cushion. It's probably about 3 inches. He doesn't weigh enough to even have it vibrate, not that he needs it, but it just props him up, and then his hands are propped up on that table, and he's obviously sitting, but she's trying. He really has very little strength in his hands.
Where are his feet?
They're not on the ground. They're propped on a little step.
Oh, they are. Okay, so he's at
can't
least
reach
got
the ground,
his feet.
so he's on a
Okay.
little step. He's just on a little step thing that we have, so that his feet are not on the, just flying in the air. But yeah, he's getting a little bit better. Like, he wasn't even able to lift his head up to do that now, at least now, and he's less timid. If we push him all the way into the table, he can get his elbows on there, and he can do a little bit of stuff with his hands. He was doing a little bit of stamping yesterday. I mean, this kid is so happy to just do anything with his hands. Just anything. He's very proud of himself. So,
Well, you said he's very smart, and
he is. He's cognitively, he's 100%. Yeah. I mean, yeah, he's not overstimulated. He doesn't go to school. None of these kids go to school. But except for us. Yeah, so they're hungry to learn stuff and do things, for sure. Yeah, that's the problem. A lot of people ask me about special needs school. We actually have a special needs school, but it's inaccessible to the kids I work with. Plus, most of the people, there's no therapist there anyways. I volunteer there when I can. They're mostly psychologists, and there's no transportation, so you have to get them there. And there's no public transportation for kids in wheelchairs. And the parents are too poor to get them there, and they need shadows, but they can't afford the shadows, so it's kind of a mute point for them to go to school.
there was a question about switches, so I want to show the switch, at least introducing the switch to him.
Yeah. He's not strong enough to push down on it. And that's I have switches that OTs have given me, but quite honestly, they never teach me how to use them. So I'm not even sure how to use some of them sometimes. I have to YouTube everything.
So I have to say that if you had all the equipment that you needed, if he was sitting on a bolster and it was a bolster that an adult could sit behind him.
Yep.
So that you could have some kind of lumbar support between you and him, so that, you're using your body to support, but you have something to help bring his lumbar spine more into extension, and you could provide stability, like higher. I wonder if he would then have a little more use of his arms.
His arms, yes. His hands are still very weak, but yes, I do have like an orange bolster that I could sit behind him. I can probably get I probably have something that I can use for lumbar support for him. If I supported him up there, he would be able to move his, his arms, his upper extremities more. For sure, he could. It's just, yeah, but it's but the hand themselves obviously are pretty weak, but he could use his hands. He likes to. He can move his hands, but he can't. He can maybe when he goes up with it, when he lifts his arm up, maybe he can bring it up by himself. Maybe not 90 degrees, but maybe 60, 70 degrees. He can do that. But he fatigues, obviously. He fatigues easy.
There's comment here. It looks like his right hand has an ulnar drift going on, maybe
Yep.
with it
They
splinting
both
off.
do. They both do.
Okay.
They both do that. Yeah, he's a little bit, yeah, he ulnar deviates. A couple of my kids ulnar deviate. It's not fixed, obviously, it's just floppy, flaccid. It's not spastic at all. But yes, he does.
And then the suggestion for getting the elbows up on the table to give him a
Yep.
little bit more stability that way.
He does. He does that a lot. I don't know why he's not doing that today. And but yeah, she almost always puts his elbows up. His elbows are up today. We saw him today. His elbows are up on the table. He does use the dot things that you were saying. The dot things. Sometimes he's still a little bit. It's just he can barely hold the dot marker thing. Yeah, with his hand. He was doing stamps today because they were a little easier for him to hold.
Okay. All right. So yeah, so the positioning of the switch vertically, sometimes changing the position of it can help them get more force. And then you were just talking about the dot markers.
Yeah, yeah.
Anything to help with wrist?
They're wide. You just can't hold the wideness. I'm not sure what a Benke splint is, but I can
A
look it up.
Bannock splint is like it's made of neoprene, and it's got a separate thumb from the
I
rest,
have this.
from the hand. And they're very simple. And well, some of them are very simple just on the hand. Some of them do come to the forearm, but the simpler ones you can either pull on, you measure the child for them, or you Velcro. For a medical device, they're remarkably still affordable.
I have some. I don't know if I had ones that fit him. I do have some. I didn't know what they were called.
Okay.
I do have some of those.
I
We can
have
try
one.
that.
You can
Yeah.
see.
Oh yeah. I have one, but it doesn't have like, I don't think it has Velcro, like those straps. I don't have the straps. It's just one piece, and so it's a little hard to get on there, but it just slides on his thumb. But that looks more sturdy. That looks way more sturdy. This is just neoprene that I have. Yeah.
And then here, using some strapping to help reduce weight and facilitate grasping may help on items like spoons, markers, etc. Laura, are you referring to like literally wrapping his hand on something to just make it easier for him to hold, or are you referring to something else? Okay, like a universal cuff. Okay, yeah.
Okay.
Are you familiar with that, Susan?
Kind of. I think so. Like you can put, yeah, so that he can hold stuff. There's a little hole that the spoon or whatever can go into.
Yeah,
Those kind of things.
yeah. I've done the same thing for grooming tools.
Yeah, because right now he really can't hold on to anything.
Yeah, you could, for kids who are wanting to groom horses, taking straps and attaching them to the small brushes so that they have, all they need is shoulder and elbow, and they don't need to even have any kind of grasp with their hands.
That would be good. He'd like that.
Yeah, since it sounds like he's so motivated to use his hands.
Yeah, he really is. He's very encouraged by little things.
All right, I think that we're going to probably stop here. Once I finally had my realizing that I could, how I needed to show these videos